Hi, this is Jack down in Dementia Land on Saturday, January 30th, 2010. And it's been a while since I did a post on my video blog, but we just had like all kinds of shocking news. And you get to the point where, or I get to the point where I don't, I'm so worn out and stuff right now. I know my judgment's not as good as it could be, and it's just like bringing some of this, of what's going on here. It's just like I don't really know if I could edit it properly, and I want to protect, his privacy and stuff. So, I don't even know if I should be doing these things, but maybe I'll keep doing them, but we'll kind of, since spring's coming, do more on plants, and I'll just occasionally mention stuff about caregiving. But what's happening today, the reason I'm not programming for one is because we finally have a nice day, and I'm been out enjoying it, working on the garden and stuff, transplanting a few gardenias and some more border grass. So I had a good day, but unfortunately BJ's having a terrible day. Among the rotten things that happened last week is he got another urinary tract infection, and then we finally got to see his regular doctor. Since BJ is having so many infections, the doctor decided to take him off the steroids that he's on for his osteoarthritis, and also the colchicine he's on for his pseudo gout. Both the prednisone and the colchicine impair the immune system and make patients more susceptible to infection. So the thought was that we would reduce the dosage of the prednisone, eliminate the colchicine, and raise the morphine to counteract the inevitable pain. So we got the new prescriptions, and I went to the drugstore to get them filled, and I looked, and it was like for 200 milligram MS cotton tablets, which is time release morphine. And at first I thought like he had been taking 100 milligram tablets, and I even asked the pharmacist, I said, is this a mistake? Do they even make them that big? And she goes, oh yeah. So I thought, well, I guess he's, that's what he's supposed to do. Unfortunately, he has had like 3 doses of it, and this morning I got him up and gave him one, and then like almost immediately realized he was really impaired. It appears to be too much morphine. He's been in there in his chair, just hasn't moved a muscle all day, so I've been going in every half hour and checking his breathing and making sure that if he's not in any kind of crisis. I think his body can handle it. So I don't know if that was a mistake. I don't know, but we're having just really rotten luck with the medication and stuff. If we could just get him to a place where we could get him stable, that would be good. So the other thing that kind of had me pretty upset, and I don't really know why, because I knew it all along, but about 2 weeks ago, the home health nurse, she administered some tests to establish a baseline for BJ's dementia. And it's a pretty simple process, and what they do is they have a little examination, and it's real famous. It's called the mini mental state examination, and it's some questions that you could take yourself, get it on the internet. BJ scored a 14, and anything less than 17 is considered severe. So they have another, this is another famous, it's an index. It describes the different levels of cognitive decline, and it's called the Global Deterioration Scale for Assessment of Primary Degenerative Dementia. And on this one, you can look up and find, essentially they score it, and then they give you a list of symptoms that the patient experiences at that stage. BJ is at level 6. It's severe cognitive decline, and it's considered middle dementia. And I've seen a lot of these symptoms. I've been telling you about them, and it's stuff like not recognizing his caregiver, not recognizing me, or talking about me to me. Um, there's like obsessive behavior, but there's all these like other things too. The delusionary behavior where he's talking to his relatives that have been dead years and years, and he's totally forgotten where he lives. Every night he asks me where he's going to sleep. He's been sleeping in his hospital bed in the same place in the house for a year and 4 months, and yet he still doesn't. Every night it's the same thing. It's like Groundhog Day, that movie Groundhog Day. Every day, the same questions, the same thing, and he's just like stuck. There's other symptoms. There's anxiety, which, when he's starting to realize how bad this mental decline is, and it's causing anxiety. The other thing that this really upset me when I read about it, because if you could think of a horror movie, like a alien getting into you or something, that's what like the dementia is. I mean, it's just if this decline happened in a shorter period, rather over a year's time, I mean, it's just hideous. It's horrific what happened. It's the patient becomes a shell. I don't even know. It's like, where did that person go? I mean, what? Anyway, this is what upset, what I always worried about. And it's even got a name. I guess seeing the name got me upset. Cognitive abulia. And it's defined as a loss of willpower because an individual cannot carry a thought long enough to determine a purposeful course of action. So BJ essentially can't even do enough planning, to roll himself from in front of the TV out onto the deck. It takes too much planning. I guess I don't want to say it, but he's become almost a vegetable. He can't do anything for himself now, except for he can still feed himself when he's not over medicated like he is today. So that really upset me last week. I read it right before I went to bed, and man, just started sobbing. I laid down just like this, just like having a seizure, and I was putting my pillow over my face so I didn't want him to hear me, because it was like so anyway, it kept going on, and it lasted a long time. He said that's grief, and I guess there's just something physical you have to do, because I haven't had any sobbing spells like that since, and I guess I felt a little better enough to carry on. But I think maybe I'm better off, if I want to do a video, we'll talk about the plants or something, and not so much this. I just want to like have a little fun and do some nice things, and like not think about bad stuff too much when I don't have to. So spring's coming though, so I saw my first signs of spring. The Formosan cherries are blooming in Tallahassee, and the swamp maples are budding out. You can see the red buds all over, and so spring's coming. So that's it for now. I better go see how BJ's doing. Hey, this is Jack. It's Sunday, January 31st, 2010 now, and I didn't want to leave my last post with a cliffhanger, so I just want to tell you all that BJ came out of his morphine stupor, and he slept it off last night. I didn't give him any more medicine, and this morning he was fine, and we'll adjust the dosage downward a lot. So I don't know how much I'm going to complain about this to the doctor, but I would like to know if it was an accident, or if he was intentionally dosing him that high. So anyway, I'm not going to put up a fuss about it, but I want to mention it. So it turned cold today. I got attacked by the Cherokee rose. It got me in the nose, and so I took out my machete and I chopped a bunch of bamboo and Cherokee rose and a bunch of other brush out of the way. So I had a good Sunday. I hope you did too. So that's all. I'll see you next time. This is Jack. Be good and grow.